ನಮಸ್ಕಾರ ನ್ಯೂಸ್ 26 ಗೆ ಸ್ವಾಗತ.
Thank you for taking time off to come and attend this little session we've organized. So recently, I think even in the media, you all would have been, hearing news, and you all have been actually publishing news about immunotherapy. So everybody in cancer treatment now is talking about immunotherapy, which means we are moving away from chemotherapy, which was the standard treatment for cancers, which has a lot of side effect and toxicity and all that, and people are talking about immunotherapy. The big highlight of immunotherapy is trying to use your own cells to fight the cancer cell and destroy the cancer cell. So that's the newest treatment, and then we've been seeing news about various centers trying to start this, and India is now coming into the forefront of that. And the newest form of treatment in that immunotherapy is called CAR T-cell therapy. It's called chimeric antigen receptor T-cell therapy. That is, what you do is you take the cells from the patient, the T cells, you collect it when they're well, change one receptor so that can identify the cancer cell, and then put the cell back. Then that will go back and kill the cancer cell in the patient. Okay? So now this is the latest form of treatment for cancer everywhere in the world. And in the US, a lot of patients have started getting this, but it is something which is horrendously expensive in the country. And for us to be, for it to be affordable to our patients, we needed it to happen in our own country. So unless, production and treatment happens in our own country, the cost will not come down. And the classic example is for bone marrow transplant, which we anyway got proof now, that earlier what used to cost, 1 to 2 crores in the US is now available for 1/10 of the cost in our country. And there are, close to about 100 centers in the country doing bone marrow transplant now. Even 20 years ago, when I started out my practice, there were less than 10 centers in the country who could do bone marrow transplant. So, using that same analogy and example, we are now saying that this treatment is also available for our own patients, and clearly we are seeing now the benefit of that. Now, looking back on the treatment, Mr. Khan will tell you what exactly he had to go through. So, all of us remember our COVID pandemic. Everybody was in trouble. We were keeping, social distancing, masking, all, housed up in our houses, locked down. So, imagine what happens to a patient who during that time gets some disease like this. If you have a disease like cancer.
My name is Khan. To put my perspective across, so this is 1.5 years in immunotherapy. So as the disease itself, if you consider, it is around 3.5 years. So before getting into this immunotherapy or CAR T-cell specifically, so the normal treatment regimen I underwent in one of the leading hospitals in Bangalore. So it gave a result initially, but in a matter of 6 months, it relapsed again. And I was going nowhere. And one of my close family doctor has suggested that you have to go to the best, who is at the best in immunotherapy as well as the BMT. Then only I came across Mr. Dr. Rtdamodar. So I went to him. So before that, the typical regimen in chemotherapy was like you lose your hair, lots of side effects, you will not be active in your day-to-day life, and all that stuff I underwent for almost 2 years. Then after coming across Dr. Rtdamodar and his team, then they have enrolled me into this CAR T-cell. So I would say, as far as the CAR T-cell therapy is concerned, not every patient can be enrolled. There are certain selection criteria is there. So I have crossed that, or I have passed that selection criteria. Then they have enrolled me. So my experience with this treatment regimen is, I would say, very, very limited side effects. Rather, I would put across 0 side effects, and I have started my day-to-day normal life. And then I usually followed the protocol also, while going through the protocol as well. There are no, I would say, the outcomes of the protocol was also found to be very, very normal. So I would like to express my
on the way developed a little bit of infection. Obviously, you go to a crowded place, you will pick up some infection. But he finished that also and came back, and you can see him now that he's well and fulfilled one of his, wishes which he wanted to do, which otherwise with disease progression and being on treatment was something which wouldn't have been possible. So that's another thing which is a highlight for him. So everybody has something you want to look forward to, especially when you have diseases like this and you want to go through as easily and as well as possible and get back to a normal life. That's the intent of any patient who's undergoing treatment, and I think it is nice to see him telling you all this in person.
ಇದಾಗಿತ್ತು ಇವತ್ತಿನ ಅಪ್ಡೇಟ್ಸ್. ಇನ್ನಷ್ಟು ಸುದ್ದಿಗಾಗಿ ನೋಡ್ತಾ ಇರಿ ನ್ಯೂಸ್ 26 ಕನ್ನಡ. ನಾವು ನಿಮ್ಮೊಂದಿಗೆ.